All right, today we're jumping straight into the emergency room. We're going to decode one of the most urgent medical situations there is, a heart attack. So let's just put ourselves in that moment. Imagine you feel this crushing pressure building in your chest. You can't get your breath. It's absolutely terrifying. And while you're feeling that, inside your body, a clock has started ticking. So what is actually happening in there? This is it, the critical moment. We're right at the start of the emergency, when your body's own alarm system is just blaring, sending out these frantic signals that something has gone very, very wrong.
Okay, so chest pain. That's the one everybody knows, right? But the problem is so much bigger than that. Look at these other signs. We're talking about this overwhelming sense of anxiety, feeling dizzy, getting that cold, clammy skin, and dyspnea, which is just the medical term for being short of breath. All of these things are clues, and they're all pointing to one thing. The heart isn't doing its job. When a patient shows up with this whole cluster of symptoms, doctors immediately start thinking, this could be acute coronary syndrome, or ACS.
All right, so the patient is in the ER with all these warning signs. The medical team springs into action. Their first move? They have to decode the heart's electrical language. That's where they're going to find their most important first clue. But before we can read those signals, we need to understand the machine that's making them, right? So, quick refresher. The heart is this amazing four-chamber pump. Think of it like this. Blood without oxygen comes into the right side, gets sent to the lungs for a refill, and then that fresh, oxygenated blood comes back to the left side to get pumped out to your entire body. It's this perfectly timed dance of valves and chambers working together. And this is how we listen in on that dance. It's called an electrocardiogram, or an ECG. Now, what's really important to get is that an ECG doesn't actually show the physical pumping. Instead, it shows the electrical signals that command the heart to pump. Every single beat creates this unique electrical signature, this waveform, and that waveform tells a story. So, how do you read that story? Well, you break down the signature. That first little bump you see, that's the P wave. That's the top two chambers, the atria, giving a squeeze. Then bam, that big spike, the QRS complex. That's the main event, the big, powerful squeeze from the ventricles, the heavy lifters of the heart. And that last little bump, the T wave, that's just the ventricles resetting, getting ready for the next beat. So just think P, QRS, T. Top squeeze, bottom squeeze, reset. Now, for a doctor in the ER, this is the smoking gun. It's the ST segment. See that flat bit of line between the big spike and that final reset wave? Normally, it should be flat. But when heart muscle is starved of oxygen and is actively being damaged, well, that line gets messed up. It can shoot upwards. That's called an elevation. Or it can dip down, become depressed. Either way, it's a massive red flag that screams myocardial infarction, or MI, a heart attack.
But, the ECG is just one piece of the puzzle. The team is also drawing blood, and they're looking for something specific, cardiac troponins. Here's a way to think about it. Imagine your heart cells are like little bags of proteins. Normally, those proteins stay inside. But if the cells get damaged and die, the bags break open and the proteins spill out into the bloodstream. Finding troponins in the blood is undeniable proof of heart muscle damage. Then they take all that info and combine it with clinical risk scores to build a complete picture of just how serious the situation is.
Okay, so we've figured out what's happening in the moment. But the bigger question is why? What's the root cause? What's the disease that leads to such a catastrophic event? So this whole emergency falls under a big umbrella term, Acute Coronary Syndrome, or ACS. All that really means is that blood flow to the heart muscle has been cut off suddenly. And the culprit, the thing that's almost always behind it, is a disease that's been quietly building up for years, maybe even decades. It's called atherosclerosis. Yeah, atherosclerosis isn't something that happens overnight. It's more like a slow-motion disaster. It all starts when the smooth, slick lining of an artery gets a little damaged. The body's immune system, trying to help, rushes to the scene. But then these immune cells start gobbling up cholesterol, and they turn into these things called foam cells. Over time, all this gunk, cholesterol, cells, debris, builds up into a hard plaque, making the artery narrower and narrower. But here's the kicker, the thing that causes the heart attack. That plaque can crack open. When it ruptures, the body panics, thinks it's a cut, and forms a blood clot right on top of it. And that clot is what can suddenly slam the door shut, completely blocking the artery. So now we know the enemy. It's time to fight back. And in the ER, this isn't just a treatment, it's a counterattack. It's a full-on, coordinated assault against the clock using every weapon they've got. And this really says it all. The mission is simple. The strategy is clear. Get that artery open, relieve the obstruction, get blood flowing back to that starving heart muscle, and do it fast.
So let's look at the first line of defense, the drugs. This is a strategic, multi-front attack. First, you've got vasodilators like nitroglycerin to help open up the blood vessels, which also helps with the pain. At the same time, you're giving anticoagulants to stop that clot from getting any bigger. Then you've got beta blockers, which are amazing because they basically tell the heart to chill out a bit, reducing its workload and its need for oxygen. And for the really big guns, sometimes they use thrombolytics. These are the clot busters, literally designed to go in and dissolve that blockage.
But here's a really important point. Those drugs are lifesavers, for sure, but a lot of the time, they're just buying time. They stabilize the patient, they control the damage, but they might not be able to bust through that physical blockage. To do that, you often have to go in and clear it out manually. And that's where this comes in. For any patient who's high risk, the gold standard treatment is an early invasive approach. This means rushing them to a special room called a cardiac Cath Lab. A cardiologist then performs what's called a coronary angiography. They thread a super thin tube all the way up to the heart, find the blockage, and then they can go to work. They can suck out the clot, and often they'll place a tiny metal scaffold, a stent, to prop the artery open and keep it open. The goal here is incredible. They talk about door-to-balloon time, and they want that to be under 90 minutes, from the moment you hit the hospital door to the moment that artery is open again. All right, we've walked through the entire crisis, from the first symptom to the high-tech treatment. So let's zoom out and really nail down the most important takeaways here. Look, if there's only one thing you take away from all this, let it be this phrase: time is muscle. Every single minute that artery is blocked, a piece of your heart muscle is dying. And that damage, it's permanent. It doesn't grow back. That's why chest pain is not a wait-and-see kind of thing. It's a call 911 now kind of thing. And please, really, don't try to drive to the hospital. When you call an ambulance, the paramedics can start that life-saving treatment right there, on the way. They're saving minutes, and by saving minutes, they're saving muscle. And this right here, this is what's at stake. This is the worst-case scenario. If too much heart muscle dies, the pump just fails. The heart can't push enough blood to keep the body alive. That's called cardiogenic shock, and it is an absolutely devastating complication. This is why we're so obsessed with time. This is why every single second matters. So I want to leave you with this question. We've seen this incredible high-speed response from the medical team. But you know where the chain of survival really starts? It starts with you. It starts with knowing the signs. It starts with making that call for help without hesitation. Preparedness isn't just for the folks in the white coats. It's for every single one of us.